We believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Dr. On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Dr. On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, one just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.
Hello, very good evening, ladies and gentlemen. Welcome to Pink October. In conjunction to our Breast Cancer Awareness Month, we are back once again with our series of webinar, and this time our title is Get It Off Your Chest, Let's Talk About Breast Cancer. I'm Dr. Sashini, and I will be your host today. For those of y'all who are tuning in with us, please type in the comment section, tell me where you're from, and tell me your name. All right, guys? For your kind information, this webinar today is brought to you by Dr. On Call with collaboration with Columbia Asia Hospital and the Asian Parent. All right, ladies and gentlemen, can I hear from you? Please type in the comment section if you're here with us. Type your name and tell me where you are from. All right. So, speaking about breast cancer, I think it's one of the most talked about cancer today. And if you look at global statistics, even in 2020, right? What it says is about 2.3 million people globally has been diagnosed with breast cancer. And out of this 2.3 million people, approximately 687,000 people actually died from it, making it the most prominent cancer globally. All right. So who do we have? Simran Joel from Kajang. Hi, Simran. For those of y'all who are here with us, please quickly take the link and send it to your loved ones. You know, we just spoke about breast cancer being one of the most prominent cancer in the world. You sharing this link, giving other people awareness might just save a life. All right. All right. Hi, Hidayah. Hi. Where are you from? Shah Alam. Fantastic. For the rest of y'all who are here, keep on letting us know where you're from and tell us your name. All right, guys? So, to shine more light on this very, very special topic, we have a very exclusive speaker with us today. She is actually graduated from University Putra, Malaysia, and she has done her specialized training in general surgeon and also with a special interest in breast surgery in University Malaya. Subsequently, she has actually practiced as a general surgeon for several years before pursuing her subspecialty in breast surgery in University Malaya. And currently, she is practicing as a consultant general surgeon with a special interest in breast surgery in Columbia Asia Hospital, Klang. Amazing, right, guys? But that is not all. We also have a very, very lovely guest speaker with us today. Only 31 years, lovely lady with the Masters in Project Management Engineering, MSc, and she is a breast cancer survivor for 10 years, ladies and gentlemen. She was diagnosed only at the tender age of 22, and she has been battling cancer for the last 10 years with 3 episodes of relapses and spread to not just a few organs, multiple organs, including the brain. And currently, she is working with the National Cancer Society Malaysia, and she is a motivational speaker, ladies and gentlemen. So let me tell you, it's not going to be just informational, but it's going to be absolutely mind-blowing. Ladies and gentlemen, if you're ready, please type ready in the comment section for us so we can get the show on the road. All right? Hi, Zalipa from Banting. Hi. So for those of y'all who are in here, quickly take the link and send it to your loved ones, guys. So without further ado, ladies and gentlemen, let us welcome our distinguished guest today, Dr. Kiran Kaur and Miss Navi Indran Pillai.
Hello,
Hello. Thank you for joining us today. Thank you for sparing time. I know you guys are very, very busy, but thank you for joining us for our session today.
Thank you, Dr. Shashini. Thanks for inviting us over to join this session. I hope it's going to be a very interesting session as well as educational for all those who are watching us today.
I'm truly sure, I'm very sure that it's going to be an amazing session because this is, I think, one of the most important topic, most spoken about, but yet many people are not aware of what to do or how to go about it. It is one of the most fearful topic, especially for women, not just in Malaysia, but I believe globally as well. So maybe we can start with yourself, Dr. Kiran. I've got so many questions to ask you, so I hope you're ready. All right. So we'll not only be asking you a few questions, we'll also be addressing some of the questions from the audience as well. So ladies and gentlemen, for those of y'all who are watching, please feel free to put in your questions or queries in the comment section. So Dr. Kiran, what is the importance of creating awareness on breast cancer today?
Okay, thanks, Dr. Shashini. It is very important to be breast aware, basically to know the impact of breast cancer in Malaysia as well as the world, because we are hoping that patients will come forward early so that we can detect breast cancer at an early stage. Then can we present the first slide, please? The idea of creating awareness as well as the importance of knowing about breast cancer is so that we prevent this kind of cases coming to us. We hope that patients who are aware about symptoms and who are aware that there's something abnormal about their breast, they will come to us early, come forward for treatment or assessment, even though it's a benign condition, so that we can get them assessed. If it is cancer, prompt treatment will affect their prognosis and they can live longer, live a good life. Yeah.
Yeah, I then definitely the early detection will definitely help a lot in terms of probably the management and the prognosis.
Yes, definitely. Early detection saves life. That's why we focus so much on public awareness, education, as well as to provide access to early treatment. Yeah. Okay, before we move on to further questions, let's have a look at the scenario in Malaysia. What is how common is breast cancer in Malaysia? Jen, can we show the next slide, please? Yeah, okay, this is a very busy slide, but basically I just want to focus on a few important facts here. Breast cancer is the commonest cancer in Malaysia. And we can see this figure of 21,925 new cases. This is based on our Malaysian data from 2012 to 2016. So over a span of 5 years, we had about 22,000 new breast cancer cases, which is about 4,000 plus a year. And the incidence is increasing every year. As I think the figures are small here, but in the previous 5 years, from 2007 to 2011, we only had about 18,000 new cases. And the following 5 years, it jumped to 22,000. So the numbers are definitely increasing. That is why it's important to create awareness so that it is a very common problem. So if you know there is a problem, seek treatment, right? Next slide, please. Okay, this is another very important slide. If we look at the pie chart, this is our Malaysian data, stage 1, 2, 3, and 4. We can see that almost 50% of our patients who are diagnosed with breast cancer, they are diagnosed at one stage of stage 3 and stage 4. Our hope is that to create awareness, patients coming early, they are diagnosed at an earlier stage, hoping that the stage 3 and stage 4 numbers will come down. 50% is very, very high, right? These patients will suffer from a lot of morbidities associated with the disease, and that is what screening and creating awareness is important to reduce these numbers. We want to detect them at an earlier stage so that prognosis is better. If we look at our lifetime risk in Malaysia, if we have a group of ladies, 27 ladies, at least one will develop breast cancer in their lifetime. This is our Malaysian statistics, actually. But the interesting thing about Malaysia is we have many races. Jen, can we see the next slide, please? Yeah, so is the incidence the same among all races? Definitely no. So it's commonest among the Chinese. 1 in 22 women, Chinese women, will get breast cancer in their lifetime, followed by Indian, 1 in 23, and then the Malay, 1 in 30. Yeah, so there is a difference among the races here. Yeah.
I'm a little bit shocked over here because as much as it's a very common topic, but this is a very alarming number. 1 in 27.
Definitely.
We have a group of ladies, 27 women. You're like, one of them is definitely breast cancer, which is pretty scary. And I think the fact that you've mentioned 50% present in stage 3 and stage 4, it's really scary because
it's alarming.
Right? Oh, yes. Wow. So that is a pretty scary number over there. For those of y'all who are just joining us, you can always write your name, tell us where you're tuning in from, and please do write your queries in the comment section during the session, and we'll address it shortly. Yeah. So, Dr. Kiran, back to you. So, looking at the situation, definitely we would want to know what are the symptoms or something we should be looking out for, right? The last thing you want is, to end up with a stage 3 or stage 4. So, what are the sort of symptoms the patient actually present with, or is that every patient actually have symptoms, or is some of them without symptoms?
Of course, not all patients with breast cancer have symptoms. We basically can group them into two groups. One is patients with symptoms, meaning they detect some abnormality in their breast and they come forward for treatment. So this group of patients are symptomatic, meaning they have some symptoms. And then we have another group of patients who do not have any symptoms, no lumps, no nipple discharge whatsoever, nothing, but they happen to get a mammogram or ultrasound done, and then some abnormality is picked up. So answering your question, definitely not all breast cancer patients have symptoms. That is the reason why we speak so much about screening, because screening is to detect when patients do not have symptoms, meaning early stages of the disease. So in terms of symptoms, these are the symptoms I have listed here, common symptoms that we see in our patients. Breast asymmetry, meaning that one side of the breast could be larger than the other side. There could be a mass or a lesion in the larger breast. Any skin changes like skin dimpling, meaning a depression on the surface of the skin. There could be an underlying tumor pulling the skin downwards or inwards. Nipple inversion, it could be having a lump behind your nipple areola complex. Any discharge from the nipple, either bloody nipple discharge or brownish nipple discharge other than milk, everything else is abnormal. Any rashes around the nipple area, any lumps or any skin ulcerations, redness, anything abnormal in the breast, please come forward for assessment and seek treatment. Skin redness not necessarily is cancer. It could be just an infection. It could be mastitis. It could be chronic granulomatous mastitis. It could be so many things. But then it could be inflammatory breast cancer as well. So any abnormality detected, please come forward for assessment.
Thank you, Dr. Kiran. I'm also seeing the various kind of lesions. After this, I'm sure everybody will be like, okay, I better go back and check.
Yeah, everyone better go home and check today.
So many different types of lesions, yeah. But Dr. Kiran, you're mentioning a lot about lumps just now, behind the nipple, around the breast, some lumps, or some is dimpling and all that. Is it possible to have lumps and not know it for years?
Oh, yes, definitely. Um, Having a lump and not knowing is still fine. We have patients having a lump, knowing the lump is there, and yet they think it's normal. Yeah. So yes, patients with bigger and larger breasts, sometimes they don't realize there's a lump within the breast. Even when they perform breast self-examination, they are unable to detect. Compared to women with smaller breasts, any lumps is easily detectable. So yes, definitely there are patients who have lumps in the breast and it's gone unnoticed for many, many months. Yes.
What would your advice be for these kind of people? As you rightfully said, some people with slightly larger breasts or a little bit more chesty, they might not be able to detect these lumps, right? So, what would your advice be in general for people? How do you detect this?
Firstly, breast self-examination is important. I think it's the information on breast self-examination is everywhere on the internet. It's easily done. Any suspicion, please come forward. Or if you are not sure how to examine your breast, you can always come and look for us, any doctors, to perform clinical breast examination for you. Jen, can we have the next slide, please? Next. Okay, yeah, we can perform a clinical breast examination for patients because we do this on a daily basis. So we are more sensitive to pick up smaller lesions in the breast or any abnormality. And then, of course, there are options of performing images like breast ultrasound for the younger age group. Mammogram is our gold standard for screening, especially those above 40 years old. Um, our clinical practice guidelines in Malaysia, we recommend mammogram once every 2 yearly to all ladies above 50 years old. So mammogram is gold standard for screening, and sometimes we do perform MRI as well for patients who have injected fillers into their breast or implant. Yeah, mammogram, if we are unable to detect lesions, so then MRI is a better option. So all these facilities are available, even if patients feel like there are lumps in the breast and they come to us, there's nothing going on or there are only benign lumps, it's fine as long as you get yourselves checked and make sure there's nothing going on. Yeah.
Right. Thank you, Dr. Kiran. Maybe we can hear from Navi. Navi, you were diagnosed, from what I was told, you were diagnosed at a very young age of 22. At 22, most of us are, just maybe still in college. Some of us probably just came out of college. Maybe you can share with us your experience. How did you first find out? Did you have any symptoms? Maybe you can share with us.
Yeah, hi. But quite bad. Um,
Navi, can you hear us? I think it's a little bit breaking. Can you hear us?
okay. Can you-
Okay, we're having a little bit of a technicality problem. Give her a moment. She's a little bit frozen. Okay, no problem. It's normal, right? Even if we are 4G, 5G, 10G, it's always normal technology. While we wait for Navi, let's get back to Dr. Kiran. So I have more. Dr. Kiran. All right, Dr. Kiran.
Hope we will have Navi back soon.
Yeah, I'm dying to hear from her and her experience. No problem. Navi, are you back with us? Okay, let's give us some time. Meanwhile, Dr. Kiran, I've been hearing about family histories and, sometimes people say it plays a role. Some people say, no, it has nothing to do. What is your take on this? Does family history actually give you a higher risk to have breast cancer?
Yes, definitely. If you have family history of breast cancer, especially in your first degree family members, first degree meaning your immediate family, your mother, your sister, your daughter, they are all your first degree relatives. If you have first degree relatives with breast cancer or even ovarian cancer, then your risk is definitely higher than the general public. Oh, Nabi is back. Okay, other than family history, of course, we have other factors that can increase one's risk for breast cancer. Those actually being a female itself is a big risk. So all of us are at risk of developing breast cancer. That is something we can't modify or we can't change. The other thing is aging. As we age, our risk increases. Based on our Malaysian data, our risk increases after the age of 25, especially, and it increases and it peaks at 60 to 64 years old. After that, it starts reducing the risk. And we have other factors like early menarche, late menopause, or taking supplements, OCP or HRT, hormonal tablets, excessive alcohol intake, obesity, all these are risk factors for breast cancer. So the advice is always maintaining a healthy lifestyle, avoid what is unnecessary, and things that you can't avoid, you can't do much about it, like your family history, your age, your gender. There's nothing much you can do about it. But what you can do for yourself is maintain a healthy lifestyle.
So, Dr. Kiran, you're mentioning that, avoiding alcohol, exercise, maintaining the weight and all that. So, does this mean that If a person or a lady doesn't consume alcohol, she exercises and she maintains her weight, is she free from breast cancer, or if she does she not have a risk?
No, no, not necessarily. You see, um, it's multifactorial. Definitely, it's not a single factor that will affect your risk for breast cancer. If you exercise regularly, you maintain a healthy weight, you don't take much alcohol, but you being a female, and for example, you're 50, even that is already a risk. So maintaining a healthy lifestyle only reduces your risk, but it doesn't guarantee that you're not going to get the disease.
Right. So, ladies, I hope you took note. It doesn't guarantee, so make sure we've got the screening and everything is in check. Navi, you're back with us. Hi.
Oh, sorry. The reception was so bad today.
No problem. We are all waiting to hear from you. In fact, we wanted to know earlier we spoke about the symptoms and all that, right? So,
Yeah.
Dr. Kiran was saying it's sort of the risk starts off from 25 and then it peaks at 60 plus, and then it goes down. And she was talking about multiple factors such as being overweight, consuming alcohol excessively, so many factors, family history. So she gave a whole list. We
Yeah.
want to hear from you. Being diagnosed at the age of 22 and battling it for the last 10 years, did you actually experience any symptoms? How did you first diagnose it? Yes, maybe
Um,
you can share with us.
yeah. So I think when you're very young, you don't expect these kind of things to happen to you, especially breast cancer, because at a very young age, we all are educated to thinking that breast cancer only happens to women like, 40s and above. So, however, when I was diagnosed, I was a bit shocked. So, what happened was I actually felt a lump on my left breast one night, just right after my shower. So, I told my mom about it. I was like, I feel like there's a lump. So, she was very worried, and then she told me, let's just go to the GP and check it out. So, I said, okay. So, we went to the GP, and then the GP told me that yes, she could feel a lump. But she told me don't be alarmed because most youngsters normally have this prior to their periods, and so I also was not so worried. So I said, oh okay. She said, nevertheless, it could be even a benign tumor that can be taken out. So why not you to a specialist? So I went and saw a specialist. Then even the specialist was very like positive. She was, oh, this always happens to young girls, and things like that. So I didn't take it so badly, although I was a bit worried, my mom especially. Um, However, I got an ultrasound done and a mammogram. Mammogram did not pick up anything because I was very young. So my tissues were still very new. So they said, yes, normally they don't pick up. However, when I did my ultrasound, they found a lump, and the lump was very irregular in shape. So that worried the doctor. She was very was shocked actually. So she was like, "This normally does not happen in young girls." So we got a biopsy done just to be sure that it was what and then yeah, so and she confirmed it. But I think at that point of time, when I was diagnosed, I was really actually quite confused. I was like, why at the age of 22, so young? But I guess cancer does not see your age or anything. If it happens to you, then it just really happens to you. So it started to sink in, and I was like, okay, cancer does not choose your age. Whether you're young or you're old, the risk is there.
Did you have any risk factors such as family history or anything of such?
So they did, because at that point of time, I was the youngest patient diagnosed at that point of time in 2015. So they did how do I say, a genetic test to see if I had that BRCA2 genes or any BRCA genes. Also to see if unfortunately they found none. And mine was just mine was diagnosed as HER2 positive. So it's very hormonal, so a hormonal imbalance.
Right. And subsequently, what happened? Maybe you can share with us what happened after that.
So after that, the treatment plan was to do chemotherapy and radiation. Of course, I did surgery first, although it differs to other people's cases. So sometimes they do surgery, then chemotherapy. Sometimes they do chemotherapy, then surgery. Depends on their treatment plan and what's best suited. So for me, it was surgery first, then chemotherapy. So I went for around 6 rounds of chemotherapy, 37 rounds of radiation, and I was also on Herceptin, so 17 rounds of Herceptin, together with hormonal therapy, 5 years on tamoxifen.
Okay. And this was the first 5 years, right? Once you were diagnosed, and then you did the surgery, and then subsequently the chemotherapy and all that, right? So
Yeah.
first 5 years, I'm guessing after that it was all okay, right?
Yeah, we
How
thought.
did you take the? Sorry.
Sorry.
No, how did you take the first round of all this treatment? How was it?
It was I think the first round, right, you don't really know what you're going for because it's new, so you don't know the side effects, you don't really understand it, you just go in knowing. And at that point of time, I really didn't have the knowledge of cancer. I didn't know what cancer was. I only knew cancer to be dramatized in movies, like when I was growing up. So I only knew cancer means, sorry to say, but cancer was death, because that was what that was projected to us. That was what that we watch on TV. Oh, so I at that point of time didn't understand the severity of the case, understand the side effects of treatments, the treatments itself, what are available for me. I didn't understand anything, but as I went along, I did some research, and at that point of time, mobile phones and everything were already picking up. So we could just really check, on Google. You could really understand. So I started doing my research back then. But also again, I thought, okay, it was done and dusted. If you do the treatments, it will never come again. All okay, everything's going to be fine and things like that. However, 5 years later, thinking that everything was going to be okay, I did my yearly round of checkups and found that I had relapsed breast cancer that spread to my my liver and my backbones. And another shocker was there, because this time it was far worse than the first, stage 4. And I was like, what did I do wrong? And then how did this happen? So many questions came about. But this time around, it was more of a disappointment. First time, because I knew that I had all over again. So whole chemotherapy session, I had to go through the side effects. Managing the side effects was one of the toughest, especially losing my hair. But I started to understand the disease. I started to understand the illness. I started to accept the illness. And I decided, I'm going to start to live my life around the illness rather than just pushing it one side and then thinking that it's never going to happen again. So, yeah, so the coping mechanism, everybody has a different coping mechanism. For me, I did the things that I love, dancing or cooking, or actually going back to work was something that really helped me out. So, yeah, I think different people doing coping with the side effects is most important.
Navi, how did you cope with your chemotherapy? Can you share your experience with chemotherapy? Because there are many people who are very, very scared and afraid of chemotherapy.
Yeah. Well, chemotherapy, as horrible as it sounds, is actually something that, it is painful, it is hard. But anything you do also, I always refer back to this quote lah, like no pain, no gain, man. So,
Well said. No pain, no gain.
no pain. So, using that, using those kind of quotes, what doesn't longer, and no pain, no gain. It pushes you through all the tough times, and it gives you the energy, the positive to go through. Also, another thing is having a very good support system. I think I was very blessed to have wonderful support systems, family, my friends. social media was go to also. So whatever that I was feeling, that I was bottling up, I would write it in a post, and I would actually post it on my social media. That was
So you
one of
get
the
it out. Yeah.
yeah. So it was my way of channeling the negativity with my post. It was quite difficult to come out and speak about my story, but once I did, I loved the I got from people. I loved the support. And the fact that I was able to shine the light for somebody who was in their darkness. So that was the way that I started to put myself in their shoes. If they are in my position, how would I cope? So throughout my chemotherapy journey, I documented media. As painful it is, I the best thing I did was to for any small issues that I had, always go back. I trusted my doctor so much. I still do trust. I anything that I felt pain, I would go back. I would go consult him. Okay, so what happened? What am I supposed to do? How can I cope with my life? And he would give me the best advice possible. So, in that sense, very good relationship with oncology. And that was the way I coped with my chemotherapy. Such a good support system. Trying to heal mentally, also consulting anytime.
Thank you, Navi. Although her line was bad, she was able to convey her story. Does she look like a patient with breast cancer?
No, she
You're
looks so
looking
fine.
great. Navi, you're looking great, and your story is really so inspiring. 10 years, ladies and gentlemen, 10 years of battling and beating cancer to the ground after 3 relapses. This is Navi Indran Pillai. Excellent, Navi. Excellent.
Thank you.
Looking forward to see more of your stories and, your sharings. I know you do a lot of this social media. You see her on social media, you will never think she's a breast cancer survivor. And that is how she beat cancer, all the way to the ground. Thank you, Navi. Dr. Kiran, back to you. So, Navi was sharing a little bit about her, how she battled cancer and, the kind of treatment option. So, the one thing that I caught from what she said is, number one, when it comes to cancer, it equates to death. Everybody is scared. No need to be diagnosed yet. We go on Google, on Dr. Google, and sort of Google our symptoms. Everything is cancer. So when the word cancer pops up anywhere, it's equivalent to death. That's how we feel. It's like we are even beaten before having a chance to even fight it. That's number one. And especially when I talk about breast cancer, most of the time people equate it to mastectomy.
Yeah.
Mastectomy, ladies and gentlemen, is more of removal of breasts, right? So this is the most common perception when it comes to treatment of breast cancer. Maybe Dr. Kiran, in your experience, you can share with us what are the treatment options available for people with breast cancer?
You have very correctly mentioned that many people they think that once they have cancer, it's equivalent to death. First thing. Second thing, there's no other choice besides mastectomy. Mastectomy simply means removal of the whole breast. But there are so many other options available in this day and age, especially when we diagnose patients with breast cancer. Actually, we sit with the patient, with our radiologist, oncologist, and we discuss what is the best option for the patient. And like Navi mentioned earlier, the treatment differs. Every patient's treatment is tailor-made. If you take 5-6 patients with breast cancer, their treatment is not the same because everyone will have a different journey, different treatment plan. But the mainstay of treatment is still surgery. All the other treatment that I have, the previous slide, Jen? The previous slide? No, previous. Yes. I have listed here chemotherapy, radiotherapy, hormonal therapy, targeted therapy. I think, Navi, you have gone through all, right? all 5.
In everything.
All 5. Yes. Herceptin is targeted therapy. Yeah.
Point I'm actually on targeted therapy for life. So which means I'm on this therapy for the rest of my life until I say stop. Yeah.
Right. That is to prevent your relapses, right? Okay. But yes, we have listed all these 5 years. Surgery is definitely the mainstay for everyone, but not everyone will require chemotherapy, radiotherapy, hormonal, and targeted. Like I said, treatment is tailor-made. Depending on every patient's situation. So not every breast cancer patient will need chemotherapy. Not every breast cancer patient will need radiotherapy. It differs, right? Okay, now let's speak about the surgical options. Okay, patients coming to us with early stage breast cancer, with small cancers, we can offer lumpectomy or breast conserving surgery, meaning that you do not have to undergo mastectomy. You can still preserve your breast. We only remove the cancerous lump together with some normal tissue around the lump. But this surgery is offered when patients come with small tumors and at an early stage. We have other options for patients who present to us with larger tumors. We have an option of giving them chemotherapy prior to surgery to shrink the tumor. So you save the patient from a mastectomy. You give neoadjuvant chemotherapy, shrink the tumor. If the tumor shrinks, then the patient can undergo lumpectomy. So you save the patient from mastectomy. Yeah, so all these options are available. Next slide, please. Yeah, okay. This is a picture. The picture above on the right is what mastectomy scar looks like. So one breast is entirely removed, and the pictures below we can see. These days we offer immediate breast reconstruction after breast surgery. So we have various options like of course implants and all, but what is preferred is using your own tissue, either from the back, you're using your latissimus dorsi muscle and flip it forward to form a new breast, or using your abdominal muscle to bring forward into the breast to create a new breast. So you have a tram flap, you have latissimus dorsi flap, and all these can be done in the same sitting as your primary surgery. So there's no fear about losing a breast, and you won't look nice when you put on fitting clothes and all that, because all this can be done. And for the tram flap, you not only create a new breast, but you also get a free tummy tuck for patients with a flabby abdomen. Yeah, so all these options are available, provided patients come forward for treatment and meet the correct doctors, right? Yeah.
Excellent. I think this is fantastic. With the advanced, medical practices that we have right now, advanced technology, it is great to know that life doesn't just end with a mastectomy, and you sort of live with this perception, especially for women. Socially there's this whole perception, I don't have my breast, I feel less of a woman. Today we've got breast reconstructive surgery and all that, and I think the bonus comes with the tummy tuck. But excellent. It's great to know that there are so many various treatments, and it's all tailor-made to the patient. It's not exactly one sort of template for all. If this is what you have, therefore you have to go immediately for a mastectomy. So thank you for sharing that, Dr. Kiran. At least most of us here, including the audience and myself, we have a clear view of what might our options be, and the fact that we do have options, I think that is very important. But that is all about ladies. So this is thing that we all here actually want to know. Talking about breast cancer, men and women both have breasts. Is it possible that men will never get breasts? I mean, this is what most people think. Only women get breast cancer, men cannot. Is it true?
No, of course it's not true that. The slide is up. We can see in Malaysia, we have had 291 male breast cancer cases over a span of 5 years. So yes, men are not spared. Men can get breast cancer too. So wives, please examine your husbands, because they will not examine their breast. Yeah.
I think after this, those who are here with us will first thing they're going to go back and, okay, I need to check you. All the spouses will be like, what is wrong with you? But when I look at your figures, 200.
Jen, next slide. Jen, backward, please. Your slides.
When I look at your number 291, that's quite a number. You know, for most of us to think that men will never get breast cancer, 291 is a pretty large number over the period of years. Is the trend increasing at the moment?
Yes, and it increases with age as well. It
Other
increases
risk
with
factors?
age. Other risk factors for male breast cancer, one is alcohol consumption, because men who take a lot of alcohol, I'm not sure if you all notice, they tend to have little breasts. They have gynecomastia. Yeah, gynecomastia is actually a benign condition. It's not cancerous, but gynecomastia means you have some amount of breast tissue in your chest. So having breast tissue is already a risk factor of developing cancer. Yeah, and then some certain medications, steroids, and all these exogenous factors can increase your risk of getting breast cancer in men.
Dr. Kiran, if a patient, male patient, if the mother or the sister has breast cancer, does that increase the risk for the male in the family also have breast cancer?
Yes, there could be a genetic link. Yeah, so family history is, of course, a significant risk factor for both men
Male
and
and
women.
female.
Yeah.
We have a question here from the audience, if you don't mind taking this question. From Nurul Huda Hassan. Kalau ibu yang menyusukan anak, ada chance ke untuk kena breast cancer? For people who are breastfeeding their babies, do they still get breast cancer?
Okay, breastfeeding is very good, and breastfeeding reduces your risk of developing breast cancer. So menyusukan bayi adalah satu perkara yang sangat-sangat bagus and turunkan risiko untuk dapat breast cancer, tetapi you still can get breast cancer sebab masih ada faktor-faktor lain yang boleh menyebabkan dapat breast cancer. So breastfeeding is protective. It reduces your risk, but it does not eliminate your risk.
So mothers out there, breastfeeding reduces the risk. So let's start breastfeeding. Definitely helps to reduce. We have another question here from the audience, from Jessica Chung. Are most lumps felt cancerous and need to be removed?
Okay, not all lumps are cancerous. Majority of patients who present to us with breast lumps are actually benign lumps. But having said that, we will have to perform a triple assessment to confirm whether it's a benign or cancerous lump. Triple assessment meaning a clinical examination by a healthcare professional, some form of imaging, either ultrasound or mammogram, followed by a biopsy. After triple assessment, only then we can tell you whether it's benign or cancerous, and a treatment will be based on the triple assessment findings. Yeah. So benign lumps, not all benign lumps need to be removed, but malignant ones definitely.
Thank you, Dr. Kiran. I hope that answers your question, Jessica. So when it comes to breast cancer, there are a lot of taboos or myths, about breast cancer that I actually want to clear out with you. So here goes. Using underarm antiperspirant, does it cause breast cancer? So some people don't use all this deodorant and all because apparently it causes cancer. So is that true?
There's a lot of rumors going around saying that, using deodorants, antiperspirants can increase your risk of developing breast cancer, especially those containing aluminium or parabens. Actually, there's no scientific studies that have proven this fact. So for now, there is no direct link between using all these deodorants and breast cancer. But studies are still being done. If you are afraid and you are not happy, then avoid using it.
Just
There's no scientific link as of now. Yeah.
How about wearing bra? So there's this whole group of people that goes, bra free because some of them feel that it may lead to breast cancer. What's your take on that?
Let it loose.
It's allowed to in Malaysia though. Yeah, let it loose.
Besides it being uncomfortable, that's why
Yeah.
I am like, okay, bra free and stuff like that.
Actually, people believe that using bras, especially the underwired bras, it prevents lymphatic flow from the breast to your lymph nodes. So a lot of toxins build up in the breast, increases your risk of breast cancer. But it is not true. It is not true.
Okay, ladies, it's not true. Okay, it's clear out there. It's not true. Quote Dr. Kiran. It's not true. All right. So feel free to put it on back. Okay. Let's not scare anyone. Yeah, of course, comfort is one thing, but the last thing we want is traffic jam and accidents because of not wearing. We don't want new statistics like that. Dr. Kiran, we have got another question from the audience. This is from Nana Mu. Pemakanan pun boleh menyebabkan breast cancer ke?
There is no direct pemakanan that can lead to breast cancer, tetapi pemakanan yang kurang sihat can increase your weight, and weight gain and obesity is definitely linked to cancer. So obesity is a risk factor for breast cancer, especially in patients after menopause. So maintaining a healthy diet, maintaining a healthy weight will reduce your risk.
So I think just to clear that, there is no specific food that causes breast cancer, but if at all your food that, the food consumption that leads to obesity gives you a higher risk to get breast cancer. Am I right?
Yes.
Okay, Nana Mul, I hope you got the answer. I hope that answers your question. We have another one from Balprem Kaur. Are lumps at the armpit area alarming, or is it only at the breast area that it should be alarming?
Okay, definitely lumps at the armpit area can be alarming, because when a breast cancer starts to spread, the first place it will go to is the lymph node in the armpit. So during breast self-examination, we always advise patients to raise their hands above their head and also look at the armpit, because if there are any lumps at the armpit, it could be a sign that something is happening in the breast. So yes, any lumps in the armpit should be checked.
Okay. Sorry, doctor, we have another question. From Fatihah Hamid. Apakah tindakan yang perlu kita buat untuk mencegah breast cancer?
Untuk mencegah breast cancer, there are a few things we can do. First thing is mencegah is prevention, correct? So in terms of prevention, when we talk about risk factors for breast cancer, we have factors which we can modify and factors which we cannot modify. Cannot modify meaning your age, your gender, being a female, family history, cannot. So that one tak boleh cegah. So yang boleh cegah is pregnancy, banyak-banyak kali pregnant, reduce your risk. Breastfeeding, reduce your risk. Elakkan daripada ambil hormone therapy, meaning oral contraceptive pill or hormone replacement therapy. Elakkan alcohol, elakkan obesity, means cara pemakanan yang sihat, exercise. All this can reduce your risk. Tapi tak boleh cegah 100% sebab we still have risk factor yang kita tak boleh modify. So apa yang kita boleh cegah, kita patutlah buat apa yang kita boleh buat. And then another thing is not only prevention, we can datang forward for screening of your breast, either with ultrasound or mammogram depending on your age, untuk kalau ada, detect awal. Yeah. Detect awal, rawat awal, then masalah settle. It won't be a masalah jangka panjang.
Excellent. Thank you, Dr. Kiran. I think that was very important topic, important question, sorry, because many people have asked the same question. How do I prevent? Sebelum jadi, mencegah. Kita nak mencegah sebelum benda itu terjadi. One more question for you, Dr. Kiran. Most people, as rightfully you said, go for your screening, mammogram or ultrasound. When we talk about mammogram, we've got free mammograms for people at a certain age, 50 and above, certain healthcare places like, hospitals or clinics, they give free mammogram vouchers and all that. But many people are afraid to come forward because they feel mammogram is unsafe or too much radiation. Mammogram itself can cause cancer. What is your take on this?
Many patients, not patients, our general public, they are afraid to come forward for mammogram. Two reasons. One, they always say takut sakit. Because mammogram, they kempis the breast sakit lah doktor. So takut nak buat. That is common. Second thing is radiation. So let me explain. Machine mammogram zaman sekarang actually tak, saya pun dah pernah buat, actually tak berapa sakit. It's bearable. Discomfort saja, tak selesa tapi boleh tahan. Second thing is in terms of radiation, the radiation is very very low for mammogram. If we compare our normal chest X-ray and mammogram, mammogram radiation is only 4 times more than our normal chest X-ray. Even if we do not perform chest X-ray or mammogram, even being alive, on Earth, you are already exposed to some degree of radiation. So mammogram just slight additional radiation. It is, when we look at this radiation, we look at it more as of the benefit versus the risk. The benefit definitely outweighs the risk. So that is why mammogram is the gold standard for screening, because it is safe. The radiation is low. The detection rate is high. Right? That is why if it is not safe, it won't be in our screening program. And screening, mammograms for screening is not only in Malaysia, is worldwide. Satu dunia buat screening mammogram. Kalau tak selamat, it will not be a screening method, right?
Yeah, excellent. I think this is something that we all had to hear because the fear is there. Walaupun dah pernah guna banyak kali, not just in Malaysia but also globally, but the fear is there. One is takut sakit. Another one is kalau pergi macam mana kalau tiba-tiba terdetect. Kalau tak pergi tak detect.
So lagi baik tak payah tahu.
Lagi baik tak payah tahu. This is a personal experience. I've seen this even within the family. So it's a common perception. We've got another question from the audience from Mazwin Jorin. Doktor nak tanya apa first symptom kalau breast cancer?
Susah nak jawab. Sebab every patient dia present dengan simptom lain-lain. Some patient commonly, majority patient present dengan lump ataupun pertumbuhan in payudara. Tapi bukan semua patient breast cancer present dengan lump. Ada setengah patient present dengan nipple discharge. Ada darah keluar daripada nipple, ada datang sebab kulit atas breast tak rata, termasuk sikit, so many symptoms. So there is no petanda yang pertama for breast cancer because setiap patient dia present lain-lain.
Okay, thank you, Dr. Kiran. My last question, I know we've got a lot of questions, the audience also got a lot of questions for you, but thank you for being patient in answering. My last question.
No problem.
What are the challenges faced in our country, especially, Malaysia, in terms of managing breast cancer?
In Malaysia, we have many patients, once they are diagnosed with breast cancer, they opt for traditional medications. They are not keen to continue with our conventional treatment. They are not keen for surgery. So we have many patients who come to us to diagnose. After diagnosis, they don't come back for treatment. We have patients who already know something is not right because the nipple, everything is already ulcerated. They don't even come to us. They directly go to traditional healers. So we have all this group of patients. They come to us when it's already advanced. That is why our rate of stage 3 and stage 4 in this country is so high. Yeah. I have a few pictures to share.
Sure, doctor.
Actually, both of these are my patients who opted for traditional medication and they came back to us. And I'm sharing their pictures with their permission. So let me just show everyone. The next slide, please. Yeah, okay, so this is one of my own patient, Madam T, 54-year-old Indian lady. She actually presented to us with a left breast lump, right? And she was diagnosed to have breast cancer after triple assessment. So, of course, we offered lumpectomy to her. She was very keen for surgery and she said, okay, I'm going to go home, I'm going to discuss with my family and come back. So we gave her an appointment after 1 week. She never came back. She called my nurse and said, no, she's not coming back. She will decide and come back later. So what happened was her whole family, they shared money, they chipped in money and all. They took her to India for some Ayurvedic treatment. So she came back to us after about a year. As we can see in this picture, the whole left breast is almost occupied by the tumor. The skin is ulcerated, the nipple is gone. And now, do you think we can offer her lumpectomy? Definitely no, right? Yeah. Now she will need mastectomy, she will need chemotherapy, you see. So she progressed from an early stage to an advanced stage because she refused treatment. Yeah. Next slide, please. Okay, this is another patient of mine, Madam R, a 50-year-old Malay lady. Okay, she presented to us with a right-sided breast lump. Also, we offered her lumpectomy. She was very frank with us when she was diagnosed. She already told us that she does not want to undergo any treatment. She is not keen to do anything. She said God has given her this problem. She will live with it. So she refused to do anything. So she sought traditional healers' help, and they were giving her some air sembayang or something like that, some prayer water to drink on a daily basis to treat her condition. So when her right breast, the skin ulcerated, she went back to him and he said, bagus. Sebab kulit dah pecah, all the toxin sedang keluar. So it's very good. So your treatment is working. So she continued her treatment and she came to the hospital one fine day because she was breathless. She was breathless because there was already fluids in her lungs. She had pleural effusion. She already had cancer spread to the other breast, and she had fluid in her lungs. So you see, from an early stage, she came to us back in stage 4. So these are the experiences these are the kind of patients we have. These are the challenges we have. If I suppose in the private practice and in the government practice, there's slight difference in the patients in terms of mentality and treatment. When they come to the private hospital, they want treatment. Those who patients who come to the government hospital just to examine and find out something, most of them, many of them, they don't come back for treatment.
Yeah, just adding that, I think even I have gotten a lot of people came and told Ayurvedic or a different type of treatment because I was having a lot of multiple relapse. So saying, oh, the modern medical use, so why not try different alternative, or Ayurvedic not working. I can understand the cancer, how it's working, and my doctors are doing the best they can to me, and I'm fine with it. So I always sit them down. I always say, "Oh, I'm sorry, thank you very much." They were like, "No, help this patient, have that." But I think for me, I believe in the modern. They are here to help. They are here with many years of research. So trust the process.
Thank you for sharing, Navi, and thank you, Dr. Kiran, especially for the pictures and all information and the sharing of the story and all that. I do believe that alternative or traditional medicine plays a role in some conditions, but maybe not all. There are some things that maybe we have to resort to more, like modern medicine or surgery. This can actually stop it at an early stage, and I think that's very apparent in terms of breast cancer per se. Leaving it alone, it becomes more aggressive, and when it reaches to stage 3 and stage 4, there's probably no turning back. So thank you once again, Dr. Kiran and Navi. I think that was a fabulous session, and I believed everyone with us today also had a fantastic time listening to the sharings and the information that was shared. My take home today was the fact that before this, we are all under this impression breast cancer equals to death or there's no turning back. But based on the early detection signs and symptoms and the mode of screening, there's so many ways with the triple assessment and the various mode of treatments that is available today. We have Navi right here, 10 years beating cancer. She is live and exclusive with us, diagnosed at an age earlier than what was predicted. Beat it once, beat it 3 other times, and still with it, which means it works, it is beatable. There is light at the end of the tunnel. So there is always hope. So, ladies and gentlemen, for those of y'all with us here today, my take-home message, which I think also applies to the rest of y'all, always check yourself, do your self-breast examination. Whether share this knowledge with your friends, family, whether even for your spouses. Apparently, men are also not spared. Okay. So do your assessment, go for your regular screening. Going for screening tests doesn't mean you're going to be diagnosed. It's just something to make sure you don't have it. And if you do, well, guess what? It's an early detection. There's so much more we can do. Don't wait till it's too late. So thank you so much for the amazing session today, Dr. Kiran and Navi.
Thank
We've
you.
got so much questions, but I'm so sorry, ladies and gentlemen, we cannot address everything. If not, it'll keep going on. So thank you so much once again for joining us. Thank you for your knowledge, Navi. Thank you for your experience. And ladies and gentlemen, thank you for joining us today. For those of you all who want to have a one-to-one personalized session, you may click on the link shared in the comment section to have a video consultation with our gorgeous Dr. Kiran. And
Thank
for
you.
those who wants to follow up with Navi, can go to her Instagram page. She is Navi Indran Pillai to catch up on her stories. In case people with breast cancer or battling breast cancer, she is probably one of the person where they can get inspiration from. All right, ladies and gentlemen.
Thank you.
Thank you for joining us.
Thank you.
All right, see y'all soon. Catch y'all in our next webinar. Yeah, bye-bye. Signing out from y'all, Dr. Sashini.